Saltzer Health Dr. Aaron Newton grew up an active athlete, which he says helps him treat both of his athletic and non-athletic patients.
I grew up an athlete. I played sports, had injuries of my own, kind of went through the rehab process. Having done that, I think gives me a unique perspective into the athletes that I see and treat, whether that's a high school athlete or even if it's, my elderly patients that all they want to do is they want to walk around the block 3 times every day. We as human beings identify a lot with the activities that we do. Once we lose that ability to perform those activities, it's a really hard thing for us to grasp. It's very nice for me as a practitioner to be able to offer them, most of the time, something simple like stretching, strengthening, range of motion exercises. A lot of my research that I did at the University of Minnesota was based on cost containment and overall cost-conscious mentality. So in speaking with administration here at Saltzer, it was immediately evident that we had a like mind with regard to that. The surgery center that we have that's not tied to a hospital allows us to provide that same level of care while not carrying that same high price with it. Being in a brand new facility is great. Having access to MRI and CAT scan downstairs, having our surgery center downstairs, physical therapy all in one is very nice and convenient, both for me as a provider and for my patients. Ideally, if I do surgery on someone and then when they come back for physical therapy, for me and the therapist to visit with that patient on the same day and be able to solidify their treatment plan, I think that means a lot to a patient. I did a subspecialty training year in orthopedic sports medicine and shoulder surgery at the University of Minnesota and spent a good amount of time with professional athletes, including the pro baseball team and pro hockey team there. It was great to be able to work with them and see them go through their own process of injury and rehab and getting back to that highest level of sport. But when it comes down to it, we're providing the same amount of care, the same imaging, the same surgery as the professional athletes get. To know that, we can still be able to provide that level of care no matter the level of athlete